Extreme fiber intake produces symptoms that look exactly like irritable bowel syndrome, urgent bowel movements, bloating, gas, and alternating between diarrhea and constipation. This creates medical confusion and potentially expensive, unnecessary testing. The symptom overlap is remarkably complete. Fiber-induced cramping and bloating feel identical to IBS symptoms. Unpredictable bowel movements become the norm because fiber effects vary daily based on what you've eaten, hydration levels, and factors you can't control. Gas production is substantial enough that diagnosing a functional gastrointestinal disorder seems obvious to both patient and doctor. The medical wild goose chase follows predictable patterns. People undergo colonoscopies to diagnose their suddenly appearing IBS symptoms. They try elimination diets attempting to identify trigger foods, when the real issue is simply consuming too much fiber overall. Expensive functional medicine testing gets ordered when reducing fiber from 80 grams to 30 would solve everything. From a physician's perspective, they're seeing classic IBS presentation. What often doesn't occur to them is asking whether the patient recently increased fiber intake from 15 grams daily to 60. Patients don't realize fiber is the cause because fiber is supposed to be healthy, so they don't mention it. The disconnect is almost comical once you see the pattern. Unnecessary interventions pile up. Prescriptions for antispasmodic medications. Dietary restrictions through low FODMAP elimination diets that remove foods that weren't actually problems. Probiotics prescribed when bacterial overgrowth from excessive fiber is the actual issue. And the irony of some doctors recommending more fiber for the IBS that excessive fiber caused in the first place. The self-diagnosis trap is particularly common. People research IBS symptoms online, recognize what they're experiencing, and convince themselves they have a chronic digestive disorder. They don't consider that their recent fiber-maxing experiment is creating a temporary IBS-like state that would resolve if they just backed off the fiber. The recovery timeline is encouraging. Reducing fiber to moderate levels typically resolves symptoms within days to weeks. The relief of discovering nothing is actually wrong medically is substantial. And most people feel rather foolish for not connecting the obvious dots between their dramatic dietary changes and their new digestive symptoms. The relationship between fiber and actual IBS is more complex. People with genuine IBS often find certain fibers, especially inulin and high FODMAP foods, worsen their symptoms significantly. Others with IBS tolerate fiber perfectly fine. Individual responses vary dramatically, which makes sweeping recommendations about fiber problematic. The communication importance cannot be overstated. Tell your doctor about dietary changes, including fiber increases. Physicians should specifically ask about supplements and dietary trends when evaluating new gastrointestinal symptoms. This simple conversation can prevent unnecessary medical procedures and save considerable money and patient anxiety.